Hello and welcome to Trojan Talk. I'm your host, Aaron Taylor, with today Dr. Lance Tatum, here to talk about COVID protocols here on campus here at Troy University. Lance, thanks for joining here today.
Oh, glad to be here. Thank you.
And we're talking COVID protocols because things are still ramping up in certain places.
Right.
But right now, where is the university from the fall to the spring semester? Where are we looking at? And things really haven't changed from the last proclamation towards the end of the fall,
No,
right?
what we did was we brought the task force together at the end of the fall. We actually had a conversation about how we would start the spring, at least based upon the information we had available to us in November. So we've started exactly the way that we finished the fall. We're encouraging people to get vaccinations, which we still have ample supply at our health center. We're asking people if you need the booster, we can do that for you as well. The part that probably has the most conversation tied around it is the mask wearing, and what we settled on was that we were going to provide the flexibility for faculty to make independent decisions about whether or not a mask would be required within the instructional area. So that's how we finished the fall, and that's how we're starting the spring.
And of course, since the fall, there have been things, the Omicron variant, the Delta variant, a lot of things started happening between now and then. Had there been any thought of potentially changing some things because of that?
Yeah, so we actually met last week prior to the first day of classes. We talked about all this, based upon the information that we're receiving from the Alabama Department of Public Health, as well as from Dean Reeves, who works with EMA. The thought is that the hospitalizations are not spiking proportionally at the same rate that they were during the Delta variant. People are getting sick, people are staying within a quarantine status for a period of time, but they are working through that much like they would work through other types of virus-related illnesses. We'll continue to watch it. We know that the cases are increasing. At least from what we have been told, the prediction is that the cases will continue to go up over the next probably 7 to 10 days. But as they begin to subside, they believe that it will be a very steep decline in the number of cases, and this won't last as long in terms of this active period that we had with Delta. So we're going to meet again next week. The task force is going to meet again next week. We'll look at everything we've got. We'll see what the Wednesday, Thursday, Friday this week looks like in terms of our case count, and if we need to make any adjustments, we'll do that.
And of course, one of the big changes, not necessarily from you all, but was from the CDC, that is the quarantine window, and that has changed, and that applies to the university as well, and anybody who's been in contact with someone with COVID.
So this is actually the third time we've had to really look at the quarantine guidelines. In the very beginning, it was a 14-day period, then it was modified to a 10-day period. The CDC put out guidelines right before we came back in the spring that actually moved it to a 5-day period. Now, there are stipulations to that. You can do 5 days. It depends on when your last booster was or when you were actually vaccinated. There's a 6-month window there, so if you're outside that 6-month window, even though you're not showing any symptoms or signs, we still want you to quarantine for the 5 days. You can come back after 5 days, but if you're outside that 6-month period, you need to wear your mask for the next 5 days. And we're having people that are actually working through this quarantine cycle, and at the moment, we don't have any major issues with it. In fact, my secretary was out last week. She's back this week, and she has a mask on. So, but that has been the big change, that from a 10-day to a 5-day. And the CDC actually gave organizations and institutions the option. You could stay with 10. There are some K-12 systems that are staying with the 10-day, but we opted for the 5.
And of course, and all of that is relevant to whether or not you have a booster. Vaccination and booster, that kind of the way it affects is it's quarantine versus mask if you've been boosted or not.
That's right. I mean, the key to what you need to adhere to is based upon, have you been vaccinated, when did you get vaccinated, and have you had your booster shot, and when all that, what was the timeline for that? So we have individuals who were vaccinated back last April, May. They haven't taken the booster yet, so if they were exposed, they would have to certainly adhere to the protocols.
And of course, the Student Health Center, you mentioned their vaccinations, but also there's the availability of testing at the Student Health Center as well for both COVID and for flu, which is important at this point as to whether or not how sick are you and what actually are you sick from.
Yeah, the Omicron variant really has some different characteristics than what Delta and the original strain had. And so the idea is, you're you're not really sure if you have the flu or if maybe you have the coronavirus. So the testing center, the health center, really is doing a great job of kind of helping our students, our faculty and staff who are not sure exactly where they fall within that area to get tested. The turnaround is still pretty quick. And so I would encourage anybody, if you're having some symptoms related to illness, and take advantage of the health center.
And of course, and once again, they can get vaccinated there as well.
That's right.
Set up a time, go there and get vaccinated, whether it's the booster or whether it's the actual first dose at this point.
That's right. And we have the J&J, the Moderna, and the Pfizer vaccines down there. So it doesn't matter really what you've had.
So all three are available at the health center now.
That's
So well, that's good to know. And once again, anybody needs any information about COVID, the protocols, what's going on, they can go to the website.
That's right. They can go to the university's www.troy.edu/coronavirus, and all the information is listed there.
All right. Well, Lance, thanks for joining us today and giving us an update on coronavirus and what's going on here at the university. Thanks for joining us.
Thank you.
Thank you for joining us on today's edition of Trojan Talk.